Hi, good morning. I am Dr. Sailaja, Cardiothoracic and Vascular Surgeon at Banjara Hills. Today I will be talking about heart valves. There are usually 4 valves in the heart. If you take the heart as a chambers, there are 4 chambers in the heart, and these chambers are guarded by the valves. Valves are more like doors, so they usually help the blood flow to be forward and not coming backward. Now there are 4 main valves in the heart. One is the aortic valve, then the mitral valve, then the tricuspid valve, and the pulmonary valve. Usually, the most commonly affected valves are the mitral and the aortic valve. There might be pathologies like stenosis, which is narrowing, or there can be pathologies like regurgitation, wherein the blood is not going forward, it is coming backward. These are the regular pathologies that we see. Now, usually the causes will be, sometimes it can be congenital, wherein the valve pathologies are present at birth or they come early in life. The most commonly affected valves in that will be mitral and pulmonary valves are more commonly affected. There can also be effect on the aortic valve also. Sometimes there can be stenosis. Other causes for these valve problems will be, usually in India, the most common pathology will be rheumatic pathology. Then there is myxomatous or degenerative. As the age progresses, sometimes the patients will be born with myxomatous tissue, where there will be progressive uh, problems in the valves. Then there can be infective pathologies sometimes, wherein the valves which are already diseased can get affected, or there can be a native valve itself can get affected. The main symptoms that we see in these patients with valve diseases will be, some patients come with cough, some patients with shortness of breath. There can be shortness of breath at rest also for some patients with very severe disease. Then there can be patients with shortness of breath while lying down, or sometimes they get up in the middle of the night with shortness of breath. Then there can be palpitations, that is, the patient will be able to feel their own heartbeat, wherein there will be increased heartbeat, usually due to tachycardia or fibrillations. Those are the later effects of these valve diseases. Then there can be fatigue. The patient will not be feeling very well, will be weak at a smaller work, more accustomed work also, they will be feeling more fatigue. Then there will be sometimes pedal edema, that is swollen legs, some abdominal tightness will be there, loss of appetite, loss of weight. These are the other symptoms. Now, normally, how do we approach these patients with these valve diseases? Usually, we do an ECG. Then, mainly the diagnosis will be based on 2D echocardiography, and to understand more in depth about each of these pathologies, we usually do transesophageal echocardiogram also. Then some patients, especially with aortic pathologies, we usually do a CT aortogram to understand the whether the disease is restricted to the valve or the whole of aorta. And usually what do we do for these patients? So there can be, the treatment usually involves medical management, then there is interventional management, then there is surgical management. Usually medical management is restricted till the surgery or the intervention is needed. Usually we give penicillin prophylaxis, then we give acetylene, that is usually for anticoagulation. Sometimes with these valve diseases, there will be dilatations of the chambers of the heart, wherein there will be chances for clot formation. For that, we will be giving drugs like acetylene. Then there is interventional management, especially it is done for mitral valve stenosis, wherein they do a percutaneous balloon valvuloplasty, or sometimes for aortic stenosis, they do transcatheter aortic valve implantation or replacements. Now, coming to us surgeons, what we do as in surgical part is, usually when it comes to congenital or myxomatous diseases or degenerative pathologies, we usually try to repair the valves. Wherein we keep the native valve and we repair it in such a way that the disease process is only removed. But sometimes the patient can have progressive disease after repair also. Then there is replacement of the valves, wherein we replace with either a mechanical valve or a tissue valve. Mechanical valve is usually restricted for less than 60 years patients, and more than 60 years patients, we usually go for a tissue valve, which is usually made of a bovine pericardium, that is of the cow, or porcine valves, that is pig valves. These are the modalities of treatment. Thank you.